Listen up, you guys, because Black social entrepreneurs are leading the way in transforming community health and well-being. It's always important, but especially within the last year since we've been dealing with the COVID pandemic and coronavirus. We have Andrew Suggs, CEO and founder of Live Chair Health, and Abner Mason, CEO and founder of Josanyo. They're joining us now to discuss how structural racism causes health disparities, and they're going to share inspiring stories of everyday people doing extraordinary things. It's an extraordinary conversation that we are about to have. So Abner, I'll start off first with you. What is social entrepreneurship in a nutshell? Break it down for us.
Sure. Social entrepreneurship is when company founders like Andrew and myself, we create companies that, in addition to the typical goals that companies have, which is to be profitable, that we also have as a central part of the mission of the company to improve society, to improve the communities in which we operate. That's what it means to be a social entrepreneur, to balance the need to be profitable with the need to improve outcomes in the communities that we work in.
Awesome. Truly doing the greater good for the most people. Andrews, tell us about Live Chair Health and what inspired you to create your awesome organization, sir.
Yeah, so Live Chair Health began after successfully running a reservation software primarily for Black barbers. And we pivoted into healthcare once my dad's health began to decline. My co-founders and I at that point began to research health disparities, and what we found was that Black men and women were overrepresented in every chronic disease category. And so we began to do research, and what we uncovered is that our community lacked the trust and access, which were the two things true of barbershops and hair salons that we were partnering with. So in 2019, after participating in the Empowered to Serve Business Accelerator, we began building networks of non-clinical and clinical resources, and we haven't looked back since.
Again, it's awesome to network with organizations that already exist in the community. And I talk to my barber all the time. They are literally like the sociologists and psychologists of the Black community, such context, because they literally meet and talk to everyone. So now, Abner, back to you. Why is supporting small startups and small businesses like barbershops and whoever else it is that you guys are supporting, why is that a thing that we should be focusing on every day of the year?
Because we need these more localized solutions to solve the big problems we have in our society. When it comes to healthcare, our healthcare system isn't working for everyone. As we've seen from the disparate impact that COVID-19 has had on communities of color, African Americans, Latinos, and others, our healthcare system just isn't equipped to serve the country we've become. We need better solutions, but top-down, one-size-fits-all isn't going to work. We need to seed. We need to encourage the growth of localized solutions. We need, to encourage entrepreneurs who have figured out a way to address problems in the local communities. We need to support those folks. And that's why I think the work that the American Heart Association has done and is doing is so important. They're providing funding to organizations, to companies like Andrew's company and mine through traditional grants, but also something new. They've got a new fund called the Bernard J. Tyson Fund, where they're making direct equity investments into social enterprises like ours. This is what we need if we're going to solve the big problems we have. We need new solutions, and those solutions are going to be, more often than not, start local.
Yes. Instead of looking from the top down, we should be looking to the left and to the right for our assistance, because as Nino Brown said in that old movie, New Jack City, I am my brother's keeper. So Andrew, back to you and Live Chair Health. What's next for you guys?
Yeah, so we're looking to expand our operations in North Carolina, Atlanta, Georgia, and Southern California, just to name a few markets, alongside the American Heart Association, and also to deploy and develop a host of initiatives like a hypertension management program to start to address the #1 killer for African Americans, which is heart disease.
Well, gentlemen, thank you so very much for joining us. Andrew Suggs, CEO and founder of Live Chair Health, and Abner Mason, CEO and founder of Josanyo. Thank you guys both. Where can we find more information about you?
Yes, you can go to heart.org / Black History Month to find more information about the American Heart Association, Josanyo, and Live Chair Health.
Awesome. Thank you very much, both gentlemen, for taking the time during Black History Month. But remember, everyone, that these messages and these ideas are useful 365 days a year throughout the rest of the year, and you can find them on firstcoastliving.net.